economically, healthcare is it's extremely expensive, and we aren't necessarily getting out of it what we think. So this is an extremely small graph, but the thing that you really need to pick out here is that here's the United States. This data is from 2008, but it's continuing to be about the same. So here we are, United States, spending more money than any other country in the world per person on our health care, almost $5,000 per person back in 2008, and yet we aren't achieving extra life. There are a number of different pieces of information. This one we're looking at life expectancy, and you can see that we're not living longer than, say, Japan, who spends only half as much per person on healthcare. Same is true if you graph infant mortality. We actually have a pretty high infant mortality rate in this country, and these things that you would think, we're putting so much money into our healthcare, we should be really healthy, we should be living a long time, and we should be living well, and we aren't necessarily doing that. So that's one component of this sustainability question. Socially, there's been inequitable access to health care for a number of reasons, and that, is somewhat, well, it's definitely a policy issue, and it's something that people have been trying to overcome with new, some of the new policies that have been implemented and are being implemented in the state of Vermont. Lots of talk about how to get better access to care, but definitely a problem for sustainability. And then environmentally, people have started looking at this. There are a few places, Healthcare Without Harm and Practice Green Health are two national, international organizations that are trying to kind of compete or take away the problems of healthcare